Good afternoon. I'm Johara Belali. I'm talking to you from Nairobi in Kenya. I'm working as the Risk Reduction and Adaptation Manager for Save the Children here in the Horn of Africa. I was employed when the crisis was unfolding around me. I was doing climate change, more normative, knowledge management type work, looking at the science, the climate impacts, adaptation solutions, and the famine was unfolding around me here in the Horn of Africa. The numbers were rising. It started to reach 13 million people of need of humanitarian assistance. So I thought, let's try it out. Let's go to the humanitarian sector and look at what is being done, what does it mean? And it was a fascinating time because although it was the biggest response in the last 60 years, the humanitarian system here in the Horn of Africa was also questioning itself. It was asking some tough questions, looking at why was there early warning and nobody could move? What happened? Why did a drought reach such extreme numbers? And the Horn of Africa then became quite a hub of discussions, of questions, of research in the middle of quite some interesting changes in the IGAD and in East Africa. It's in that context that UNHCR approached us and talked to us about coming out and understanding what the practitioners were doing. So we brought 12 people together as a think tank on drought. We had modelers from all over the world. We had social scientists, professors in science from here, from the region. We had some colleagues who are working in the Sahel. We had a whole bunch of different people, including the private sector, Syngenta, who came. And we tried to ask ourselves these difficult questions. What is drought? How does it affect people? How can it affect people so strongly? What are the underlying causes, the drivers? And after a few months of research and looking more thoroughly at it, and especially looking at the development deficit, looking at the underlying causes of how people are being impacted through the increased vulnerabilities, the cumulative vulnerabilities, some aspects come out quite clearly. It is not a question of food production. People actually don't have access to the food because they can't afford it. It's not because the food is not there. Why can't they afford it? Where is the food? There's also, of course, the whole complexity of drought risk and looking at solutions of drought risk reduction, looking at the climate impacts, the Horn of Africa being one of the most vulnerable hotspots in the world in terms of climate change. It's been fascinating to have the points of view of doctors, of agribusiness, of agroecologists, social scientists, and modelers through this UNHCR bringing us together. And the results came out in the chapter 10 and 7 of the GAR 2013. The journey is carrying on. There is a real change and a real movement going on in East Africa and I believe in the Sahel also, talking about resilience, talking about resilient programming, and large funds are coming through here. But are the investments going in the right directions? Are they listening to the people, to the changes that are going on in the pastoralist, in the agro-pastoralist? Are they listening to what the land and the water is telling us in the sense of the stresses that are occurring there? I strongly believe that in a drought situation, in these vulnerable hotspots where we do have these chronicle, cyclical drought and flood situations, we cannot do anything without really investing in the ecosystems and really investing in building a strong link between the people and their ecosystems to build their sustainability and their resilience together. Economics, investments, markets, agribusinesses coming in that domain need to think and work to increase that strength that the people, the adaptive capacity, and the ecosystems have. And then I think there's really a really strong win-win situation that can occur. We're thinking about agroecology, permaculture, really systems that are decentralized and they're bringing back the control and the power to the people who are using and living in those areas. Thank you.